It's time now for the Business Spotlight here on News Talk 94.7 and 970 WMAY. Today we're visiting with Dr. Jennifer Schuermann from the SIU School of Medicine, and she is a 2018 resident from the Family and Community Medicine, class of 2018. And one of the things that we hear a lot about in the news, and it's such a tragic thing, is sudden infant death syndrome, sometimes called SIDS. What is that?
So, SIDS, like you said, stands for Sudden Infant Death Syndrome, and this is the sudden death of an infant less than 1 year of age that cannot be explained after a complete evaluation is done by a medical professional. It's a sudden and silent medical disorder that can happen to any infant who seems healthy. And it's the leading cause of death among babies between 1 month and 1 year of age. In 2015, there was about 1,600 infants that died of SIDS.
Wow, that's and gosh, as a parent, that's it's horrifying to think about that, and such a sad thing to happen. Is there any way to prevent that?
That's a great question. So, not exactly. Healthcare providers and researchers don't know what the exact cause of SIDS is, and so there's no exact way to prevent it. However, research shows that parents and caregivers can take certain actions to help reduce the risk of SIDS and other sleep-related causes of infant death. Some of these things to help reduce the risk of SIDS include getting regular health care during pregnancy. Don't smoke, drink alcohol, or use illegal drugs during pregnancy or after the baby's born. Breastfeeding your baby can help reduce the risk of SIDS. We recommend that you don't use a home heart or breathing monitor to reduce the risk of SIDS. Do not allow smoke around your baby. It's also important you can give your baby a pacifier for naps and at night, and that can help reduce the risk of SIDS. Don't let your baby get too hot during sleep. Make sure you follow up with your healthcare provider on your baby's vaccines and regular health checkups. And, of course, remember tummy time. So placing babies on their stomachs when they're awake and when someone's watching can help, because that helps your baby's head, neck, and shoulders get stronger so that they can turn over on their own.
It's fascinating to me that there's not a lot known about it, and it's more or less classified as passing away for an unknown reason, and yet there are some things you can do that certainly will reduce the odds of it happening. Is that kind of what I hear you saying?
Yes, that's correct. So kind of all those things that I just mentioned can help reduce your risk, or your child's risk of SIDS, but it can't be prevented.
We're going to learn a little bit more about SIDS and discuss that further here. We're talking with Dr. Jennifer Schuermann from SIU Medicine. It's the Business Spotlight here on News Talk 94.7 and 970 WMAY.
Providing high-quality care, innovative education and research, and community services in 66 counties. SIU Medicine serves 2.2 million people in central and southern Illinois. Services include 5 community health centers through SIU's Center for Family Medicine. SIU Medicine offers state-of-the-art education, patient care, and research in a warm, caring environment. SIU Medicine. Forward for you. Visit siumed.org. or call 585-8000.
You're listening to the Business Spotlight here on News Talk 94.7 and 970 WMAY, and today we're visiting with Dr. Jennifer Schuermann from the Family and Community Medicine at SIU, and we're talking about a pretty serious issue, and it's one that I know really frightens a lot of parents, and it's called SIDS, Sudden Infancy Death Syndrome. A happening that really is almost unexplainable, and a child passes away in the night. I know there's a lot of research on that. What's the latest? What kind of progress are we making?
That's a great question. So the medical community has made great progress in reducing SIDS. The largest decline in SIDS rates actually occurred a while ago. It's between 1992 and 1999. In 1994, a campaign started that was called Safe to Sleep campaign, formerly known as the Back to Sleep campaign. So this campaign encouraged all parents to place their babies on their backs to sleep. And after that started, the overall SIDS rate in the United States dropped by more than 50%. And during that same time period, the rates of babies sleeping on their backs more than doubled. So the take-home point from that is that, placing your baby on their back to sleep is the safest way and can reduce your risk of SIDS.
Okay, but contrast that a little bit, because earlier you said the importance of tummy time. Where's the difference there? Is it just not letting them sleep?
Yes, so tummy time is only when your baby is awake and
Okay.
you are supervising that time. Tummy time usually doesn't last too long. It might last, 10 to 20 minutes. A lot of babies, kind of get fussy after they're on their bellies for a while.
I gotcha.
But then when you place your baby down for any naps or any, at night to sleep, you definitely want to place them on their back.
Are there things that SIDS is not?
Yes. So just it's important to know that SIDS is not the result of neglect or child abuse.
Okay.
SIDS is not contagious. It's not caused by vaccines, immunizations, or shots. It's not caused by vomiting or choking. It's not the same as suffocation, and it's not caused by suffocation. And so it's just kind of important to know those things. And like
Okay.
I said before, it's not completely preventable, but there are ways to reduce the risk, which we have discussed. And I do have a couple more points about a safe sleep environment that can also reduce your risk of SIDS.
Yeah, and I think that's an important distinction as well. And I'm glad you outlined what it's not. But there's obviously a lot of things that happen because this occurs while the baby's asleep, right?
Yes.
Okay.
Yep.
So what would you consider a safe sleep environment?
So a safe sleep environment includes a firm sleep surface, such as a mattress, and a safety-approved crib covered by a fitted sheet. You don't want to have any pillows, blankets, or crib bumpers anywhere in your baby's sleep area. It's also important to keep soft objects, toys, and loose bedding out of the baby's sleep area. You want to dress your baby in light sleep clothing, such as a one-piece sleeper, and don't use a blanket. And like I said before, always place your baby on his or her back to sleep for naps and at night. It's also important to not co-sleep. And so what I mean by that is that a baby should not sleep with you or with anyone else on a bed, a couch, or a chair. Sharing your room with your baby is important, but not your bed.
Not the
So
bed.
keeping your baby in a separate sleep surface, such as a bassinet, close to your bed is ideal for the baby's first year, but at least for the first 6 months. But like I said, you do not want to co-sleep, and you don't want your baby in your bed with you.
That's good advice and important advice, and you can find out more by going to siumed.org. Dr. Schuermann, thank you very much for visiting with us today.
You're welcome.
It's the Business Spotlight here on News Talk 94.7 and 970 WMAY.